Personal protective equipment refers to a variety of barriers used alone or in combination to protect mucous membranes, airways, skin and clothing from contact with infectious agents. PPE, used as part of standard precautions, includes aprons, gowns, surgical and P2 or N95 masks, protective eyewear, and face shields. Selection of PPE is based on the type of patient interaction, known or possible infectious agents, and the likely mode of transmission. This video will demonstrate how to fit and remove personal protective equipment in the correct order. We will highlight all the necessary steps in both the application and removal of PPE. Fit PPE in this order. Step 1. Perform hand hygiene. Washing hands with soap and water should occur for between 15 to 30 seconds, and hand rub with alcohol-based formulations should occur for 15 seconds. Refer to your local hospital hand hygiene procedure for more information. Step 2. Don an impermeable or fluid repellent long sleeve gown. Step 3. Apply an appropriate mask. Standard or surgical masks are single-use items that cover the nose and mouth and are used as part of standard precautions to keep splashes or sprays from reaching the mouth and nose of the wearer. Particulate, P2 or N95 respirators should be worn for known or suspected airborne precautions. To apply the P2 or N95 mask, first examine the mask to ensure that there are no tears or defects. Separate the mask edges and then put a small bend in the nose wire. Hold the mask upside down and gently shake out the straps. Use your index fingers and thumbs to separate the two headbands, ensuring that the nose piece is at the top of the mask. Place your chin into the cup of the mask and pull the headbands up and over your head, and release the lower headband from your thumbs and position it at the base of the neck. Position the remaining headband on the crown of the head. Conform the nose piece across the bridge of the nose by firmly pressing down, ensuring the mask is fitted across the nose and cheekbones. Adjust the P2 or N95 mask until a good facial fit is achieved. Step 4. Perform a fit check of the P2 or N95 respirator. A fit check is required each time an N95 mask is applied prior to entering the patient's room. To fit check the P2 or N95 respirator, inhale and exhale several times while wearing the mask. The mask should collapse slightly upon inhalation and expand on exhalation. There should be no air leaking around the mask. If air is leaking around the mask, check the perimeter of the mask and adjust the placement of the straps to see if a seal can be achieved. If a seal is unable to be achieved, then remove the mask and look for defects. If there is an obvious defect, then discard the mask and choose a new mask and start the process again. If you are unable to achieve a seal and there is no defect in your mask, you must consult with your nurse unit manager, team leader, educator or facilitator to assist you with your troubleshooting and to assure that appropriate escalation and management occurs. Step 5. Apply eye protection. Step 6. Apply gloves. If long sleeve gown is in use, ensure that the gloves cover the cuffs of the gown. Once all these steps have been followed, you are now prepared to provide care to your patient. Remember that when wearing gloves, hand hygiene should still occur, according to the 5 moments of hand hygiene, during the care of your patient. The use of gloves does not replace the need for hand hygiene. It is vital to remove your PPE in the correct order. This is to ensure that you do not expose yourself to contaminants. In the patient's room, remove PPE in this order. Step 1. Remove gloves away from your body and dispose of them in a clinical waste bin. Step 2. Perform hand hygiene. If hands are visibly soiled, use soap and water. If not, hand washing can be replaced with alcohol-based formulation. Step 3. Remove eye protection, ensuring your hands do not come in contact with your mask or gown. Dispose of the glasses in a clinical waste bin. Step 4. Perform hand hygiene. Step 5. Remove your plastic apron or long-sleeved gown by starting at the back and folding the gown in on itself and away from your body. Dispose of the gown in a clinical waste bin. Make sure that you only touch the inside of the gown. Step 6. Perform hand hygiene. Performing hand hygiene is vital in ensuring you minimize any possible contamination in the removal of PPE. Always ensure that you follow each step. Upon exiting a patient's room, remember the 5 moments of hand hygiene. Step 7. Remove mask. Remove the mask immediately on exiting the patient's room or space. Remove the mask by lifting the headbands only, removing the bottom strap first, ensuring that you do not touch the front of the mask and that the mask moves away from your body. Dispose of the mask in a clinical waste bin. Step 8. As soon as you remove the mask, perform hand hygiene. This step is critical as it is the most common time healthcare workers contaminate themselves or their surroundings. After performing all of these steps, you have completed the safe removal of your personal protective equipment. For further information, refer to your local hospital infection prevention and control procedure and your local infection control team.